man who brought the issue to a head, the Assistant Health Minister, Dr. Chris Davis, joined me in the studio earlier. Dr. Davis, on Monday you said in a letter that your position in the government was untenable. Why did you want to quit?
It was not untenable at that time. There was just the potential, if we had a situation where I perceived that our medical workforce, and this of course is based on feedback, was beginning to leave, and I felt there was a better way to retain them, and that opportunity was not provided, then I could not stand by and allow that to occur. I also wanted there to be a robust discussion about the best way to actually engage our clinical workforce, and so that was another area where I thought there was a lot of potential for improvement, and if we didn't succeed, then I thought I should hand over to someone who might make a better job of it.
How close did you get to quitting?
Well, I had
Did you hand in your resignation letter or offer your resignation at any point?
Ultimately, these decisions, of course, are a matter for the Premier. And based
on... So you did offer a resignation?
No, but I mean the Premier's discretion at any time to actually withdraw one's commission, I suppose, as an Assistant Minister. But it was really a matter of feedback from constituents, from my parliamentary colleagues, the support of my minister. There was actually appreciation, I believe, from the Premier for actually having raised this robust discussion.
On the Tuesday morning after this quite explosive letter, you explained fairly much what you were just saying. Then you went silent. Why?
The minister really wished to reassure everybody that his views were ones that I'd taken on board, and essentially I was comfortable that the minister, of course, had that right, and so I didn't really go silent. I certainly didn't withdraw my letter, because the letter was based on information from particularly constituents, and it was really in response to the post-Redcliffe by-election, the commitment to listen and consult, and I'd been doing that, and I'd brought that information in good faith to the party room.
Were you silenced by the minister?
Not as such, no, and at the end of the day, of course, I also have a responsibility as the member for Stafford, and because we have the Prince Charles Hospital as the major employer in the electorate of Stafford, and there are also many doctors who work at the Royal Brisbane and Women's Hospital as well as the Royal Children's Hospital in my electorate, so I am very much obliged to represent their interests and, of course, all the other interests in the electorate.
Going on to the contracts, you are a former AMAQ president, as well as the Assistant Health Minister and the member for Stafford. So a lot of doctors will be looking to you for guidance on this. Are you willing to give the contracts the thumbs up?
There's work to be done, but what's exciting is that that work is actually now in progress, and there's some very clear messages that the Premier has very much reiterated this week, and that is the value placed on our senior medical officers, as well as, of course, our healthcare teams across the state, but also the message that there is a genuine commitment to resolving the matter, and very importantly too, that there is a zero tolerance of people getting paid for work they haven't done.
Now, the latest meeting that happened last night seems to have centred around a few key principles. Now, doctors seem to be worried about the contracts could be unilaterally changed by the government. They can be moved at a day's notice within their health service district. They cannot appeal to the Queensland Industrial Relations Commission. Have any of those been settled as far as you're concerned?
At this stage, the commitment is to work through those with genuine goodwill, great intensity, and to look at the perceptions underlying that, as the Minister has said, but at least we're underway, which is what is important.
Lawrence Springborg has said he will not change the wording of the contracts. That seems to be a real sticking point for the doctors, because they say that if it's written in black and white, they've got nowhere to go.
Well, again, I think if we are absolutely committed, as I understand from last night, to a fair and reasonable solution, then in any negotiation you've got to look at alternatives. So there may be a different way of ensuring that there is proper mediation for differences of opinion regarding certain disciplinary matters and so on. So it's not the QIRC, but there are other ways.
So that's the private mediation that was the problem there?
Well, there is the opportunity to have a different mediation process.
But that's non-binding?
Well, again, one can look at how that works out in practice, and I don't want to preempt what that might look like. But again, it is recognised as a significant issue, and I think we all, have the potential to make mistakes, whether we're doctors, politicians, managers, and we really want a process that is seen as acceptable for a second opinion, if you will, and particularly from what we've learned from post-Bundaberg, for example, where there was certainly pressure on people who were expressing concerns, and you don't want a situation where those people now could be dismissed instead of just ignored. So we do need to recognise that it is part of a good democracy, but also part of a good safety system to actually allow people to be heard without being disciplined.
Dr. Davis, looks like there's more negotiation ahead of us, but thank you very much for coming in tonight.
Thank you very much, and hopefully we will get great results for patients as well as our healthcare team.